The typical registered nurse makes about $86,070 a year, and the top 10% clear over $132,680 per the Bureau of Labor Statistics, or BLS. Hospitals need nurses so badly that BLS projects roughly 197,000 openings per year this decade, and travel assignments can annualize above 150,000 during crunches. Here's the twist. Artificial intelligence, or AI for short, is rolling into nursing with ambient scribes that save 1 to 2 hours of charting each shift. In this video, we break down what registered nurses really earn across states and specialties. Then we look at whether those smart tools help or replace parts of the job. Registered nurses coordinate and deliver patient care, administer medications, start intravenous lines, monitor vitals, and teach patients and families what to do at home. They work in hospitals, outpatient clinics, surgery centers, long-term care, schools, and home health. The largest employers are general medical and surgical hospitals. Shifts run days, evenings, and nights. Expect weekends and holidays because bodies do not schedule emergencies. Many units use 12-hour shifts with built-in overtime risk. Registered nurses collaborate with physicians, pharmacists, respiratory therapists, and social workers to carry out care plans and catch problems early. Specialties vary widely. Emergency department, or ED, intensive care unit, or ICU, operating room, or OR, oncology, pediatrics, and more. According to BLS wage survey data from May 2024, the median registered nurse earns about $86,070 per year nationwide. The mean pay is about $98,430, reflecting significant overtime and high-cost metro premiums. The top 10% make over $132,680, while the bottom 10% earn under $66,030. If you think hourly, the median is about $41.38 per hour. Employment is massive. Around 3,175,000 people work as registered nurses, making it one of the largest occupations in the country. Where you live matters. California sits on top with a median around $137,690. Hawaii, Oregon, Massachusetts, and Alaska round out the top 5, all above $109,000 on median pay. On the low end, South Dakota, Mississippi, Iowa, Alabama, and Arkansas cluster between about $64,000 and $69,000 on median. That geography gap is real. A California median is roughly double a Mississippi median at about 2 times the pay. New grads start lower, of course. First-year registered nurses commonly see $55,000 to $70,000 base, with big city academic hospitals offering $70,000 to $90,000 to attract talent. In rural parts of the Southeast, postings still land around $52,000 to $60,000 for brand new nurses. Specialty training pushes pay up. Charge nurses and critical care staff in high-paying states often reach $110,000 to $140,000 W-2. Advanced practice is a different tier. Nurse practitioners, abbreviated NP, have a median around $126,260. Nurse anesthetists, or CRNA, post a median near $212,650, among the highest-paid non-physician roles. Nurse midwives report a median around $129,650. Travel nursing spikes earnings. Typical contracts run $1,500 to $3,000 per week, and during peak shortages, some hit $5,000 to $10,000 per week. Most nurses are hourly. Nights usually add $3 to $8 per hour. Weekends add 2 to 5, and holidays often pay 1.5 to 2 times base. Unions and staffing ratios matter for predictability. Pay ladders, differentials, and overtime rules are usually spelled out in hospital contracts. Allied roles like dental hygienists and ultrasound techs also have defined ladders. There are 3 main entry paths. The Associate Degree in Nursing, or ADN, takes about 2 years at a community college and can cost $3,000 to $30,000 total tuition. The Bachelor of Science in Nursing, or BSN, takes about 4 years and ranges from $40,000 at public universities to $200,000 at private schools. Career changers sometimes use direct entry Master of Science in Nursing programs, finished in around 3 years, typically costing $60,000 to $150,000. After school, you must pass the National Council Licensure Examination for Registered Nurses, or NCLEX-RN, to get your license. First-time pass rates for BSN graduates are around 88%, according to the National Council of State Boards of Nursing. Many hospitals now require new hires to either have a BSN or commit to earning one within 5 years. New grad residency programs run 6 to 12 months, pairing classes with precepted shifts so you can handle higher acuity safely. From day zero to working as a licensed registered nurse takes about 2 years on the ADN path and about 4 years on the BSN path. If you want advanced practice, plan for 2 to 4 more years for a Master of Science in Nursing or Doctor of Nursing practice, with certified registered nurse anesthetist programs now doctoral only. Let us talk about the tech. What can these tools actually do inside nursing right now? Ambient note-taking is real. Microsoft's Nuance DAX Copilot, Abridge, and Suki listen during the visit and draft the clinical note automatically. Electronic health records, or EHR, now ship with assistance. Epic Hyperdrive and Oracle Cerner can suggest orders, fill out flow sheets, and surface relevant history. Predictive monitoring flags trouble early, sepsis and deterioration models, like the Epic Deterioration Index and Bayesian Health Watchers, scan vitals and labs for red flags. Hardware is smarter too. Infusion pumps from BD Alaris and ICU Medical include dose error reduction, while Pyxis and Omnicell handle medication dispensing with guardrails. AI triage bots exist mostly before the visit. K-Health, Buoy Health, and Ada guide patients to the right level of care but do not replace bedside work. One headline name is Hippocratic AI, a company building voice agents. Despite the branding, they focus on non-clinical outbound calls like medication reminders and post-discharge check-ins, not bedside replacement. Now the limits. These systems cannot bathe, turn, or ambulate a frail patient, start an intravenous or IV line, change a central line dressing, or navigate an end-of-life conversation. They do not own real-time clinical judgment during a code blue or rapid response, when seconds and hands-on assessment decide what happens next. Authoritative research lines up on the timeline. Goldman Sachs classifies healthcare practitioners as among the least exposed roles to automation by generative models. The World Economic Forum, or WEF, lists nursing as a growing role through 2030 with low displacement risk and expects healthcare to add net jobs. McKinsey Research puts physical caregiving in the highly resistant bucket, while estimating that roughly a third of documentation and admin work can be automated or assisted. Our verdict based on these sources is low risk of displacement over the next 10+ years. The technology boosts documentation and monitoring, but the bedside stays human. Want to hedge anyway? Specialize. Nurse practitioner, certified registered nurse anesthetist, informatics nurse, infection control, oncology, ICU, and ED roles pay premiums from $15,000 to 6 figures. Use geography arbitrage. California, Hawaii, Oregon, Massachusetts, and Alaska reliably outpay low-wage states on absolute dollars, even after cost of living. Consider a 1 to 2 year travel window in your late 20s or early 30s to stack savings while demand is hot. If you start with an ADN, plan to bridge to a BSN. Many magnet hospitals require a BSN within 5 years for advancement. Lean into the smart tools. Early adopters of DAX Copilot, Abridge, and Epic Assistance save 1 to 2 hours per shift and write cleaner notes. Avoid stagnation. Indefinite floor nursing in a low-paying state without specialty certification tends to be the slowest compensation curve in the field. Nursing is hard, meaningful work with reliable pay and overtime upside. Burnout and night shifts are real, but the market needs you. If you like fast problem-solving, direct patient contact, and being the calm in chaos, this path fits. If you prefer quiet solo work, hate bodily fluids, or need a predictable 9 to 5, nursing may not be your lane. Want to keep building a future-proof career? Click the video on the screen to keep going.